Hello, everybody. My name is Sorin, and our guest for today is Dr. Jose Carlos Martins da Rosa from Brazil. Doctor, thank you very much for accepting our invitation today. How are you doing?
I'm fine. Thank you for the invitation. It's always a pleasure to come back to Romania. Romania is a very nice city, very nice town, and I feel like I was in my house.
That's good. That's nice. Nice to hear that. So, doctor, my first question for you today: what drive you to become a dentist?
Well, it's a long story, but let's make this story as short as possible. I came from a family, and my old brothers and sisters, they are dentists. I'm the fourth one
Okay.
in my family. So they suggested me to be a dentist, and I think I am a dentist since I was wearing diapers, because everybody usually say to me that I was born to be a dentist. I don't know if they are right, but I'm still doing my best as a dentist.
Nice to hear that. Great. Uh, Doctor, everybody's talking about the IDR technique. Can you tell us more about this amazing technique, please?
IDR became very famous worldwide. There are thousands of people using this technique and get the best outcomes ever in the management of compromised sockets. And this technique, is quite simple. It was developed to manage compromised socket. Doesn't matter the extension of the bone defect. Sometimes when it's missing one wall, as buccal wall, for example, sometimes we have two defects. It's missing the buccal and the palatal, or we may have all defects, the defects all around the condemned tooth as a 360 defect. But we can use this technique to manage regardless of the extension of the bone defect in the presence of gingival recession or the papillary loss. It's a phenomenon, but it's true that this technique can be used in the management of compromised sockets in the very simple way.
Nice, interesting. Tell me, how did you acquire the knowledge and the skills that help you to establish this the IDR technique?
I did my, after I finished my graduation degree, I did a specialization in perio and prosto, and I did my master degree in prosto, and after that, I did my doctorate degree in implants. I think I put all together in the same package, and I got lots of knowledge and experience in the last years. I graduated for more than 30 years ago, so I have lots of experience in implant dentistry, bone graft manipulation, and soft tissue graft manipulation as well. So I'm very experienced in prosto as well. So this technique is when we put all together: implant installation, provisional crown fabrication, and bone or bone plus soft tissue graft. That's all about IDR technique.
Fantastic. So you put them all together, and it's just like the miracle happened.
This is not magic. This is all based on biological response. That's why this technique works so perfectly in the management of compromised sockets.
You know, we live in a world where everybody is looking, or almost everybody is looking for tips and tricks. Everybody is looking to find, those small details that make the difference. And I wanted to ask you, what is your best tip for a dentist that would like to work or start to work with your technique?
I think the best tip to give for the audience is something like this. According to my experience, this is what I learned in the last 18 years working with this technique. I realized that that's the best way to go in the management of compromised socket. It's because it's quite simple to and very well reproducible, and it represents low cost and high predictability, not only for us as a dentist, but for the patient. And this is what the patients are really looking for, especially in anterior zone, but also in the posterior zone in the management of compromised sockets.
Thank you very much. We're talking about dentists and about your colleagues, but I'm quite sure that also the patient plays a very important role in the success or the outcome of the procedure and of the intervention. Could you agree with me? Are there any factors that the patient should be aware of or should take in consideration in order to have a long-lasting result after the intervention?
Yes, that's the main advantages of the IDR technique. Everything is going to be solved in one single surgery. Doesn't matter, as I said before, if you have the combination with bone loss in combination with gingival recession, we don't need to open the flap. So that's the main advantages, is to perform everything in one single surgery. And every single patient will leave the clinic, will leave the surgery room with the provisional restoration in place. It makes difference, lots of difference, because this is what the patients are really looking for. Not only to have a fast outcome, but to receive the best outcome in the management of hard and soft tissue damage, and to keep or to improve the positioning of the gingival margin and the papillary height position. This is what the patients are really looking for.
Fantastic. Now, coming back a step in advance regarding the procedure, can you describe in a few words some of the things that you might evaluate before starting the surgical procedure, the IDR surgical procedure? Coming back to the dentist part now.
Yes, Sorin, this is one of the most important aspect to be considered in apply the IDR technique. We have to evaluate the case in the most accurate way possible, using clinical evaluation, X-ray, CBCT scan, 3D image, and the prototyping. So you should see and to evaluate the defect itself the best way possible in order to realize the configuration of the defect, not only the hard tissue, but sometimes hard and soft tissue, before you apply the IDR technique. And you can also take advantages on this exam, not only to evaluate the receptor side, but also the donor side, the maxillary tuberosity area. We are able nowadays to evaluate the amount of bone, the volume of bone available, and the soft tissue available in the tuberosity area prior to the surgery. It makes our life much easier, and we are able nowadays to offer this kind of treatment for the patient in the easiest way possible.
Perfect. Thank you very much. Now, I mean, you have You have more than 18 years experience working and improving the IDR technique, which is amazing. And congratulations once again for that.
Thank you so much.
In all this experience, would it be possible for you to put summarize and say what would be the ideal profile of a dentist starting the program and following this technique? Or can we do this kind of labeling, or is just general valid for every dentist technique?
This technique values for all dentists. Doesn't matter how experienced they are, if they have lots of experience surgery or they are only the beginners. Sometimes the beginners catch the meaning faster than the more experienced clinicians. So I had experience with all kinds of level of experience, and I realized that everybody is able to apply this technique. But much more important than to apply this technique is to follow the protocol, to follow the rules that we developed more than 8 years ago, and we got lots of experience on that. What's our job? To share our experience and to teach as many as possible dentists around the world in order to offer this technology, this technique for their patients, and to get the best outcomes ever in the management of compromised sockets.
Perfect. Thank you very much. Talking about experience, dentistry is changing a lot, and we are now facing AI, artificial intelligence. We are facing a lot towards digital dentistry. From your professional perspective, how do you see evolution of dentistry in the following years?
Sorin, summarize this question. In the last years, we have lots of evolution. Like, for example, the best clinicians in the world are wearing loupes, magnification. This improved a lot our job and our outcomes. What else? Digital workflow to take advantages on the technology. What else? oscillosification concept, and I'm sure IDR technique. IDR technique is a revolution in the management of compromised sockets. We are not talking about the future. This is the present. In the present, we are living in the best era of dentistry.
Nice, perfect, nice said. I have to be honest with you. I'm very, very impressed about the training center, the facility that you have in Brazil back home. It's amazing. I've seen it only in videos. I've seen what you've done there. I've seen the classes that you had there, and the program. It looks amazing. I'm very excited because we have prepared together for end of this year. Quite interesting program that we're going to do together in Brazil, in Caxias do Sul, in your training center. So we've made there like a 8-day full package involving the full IDR expert program, so the full 4 days program, training program in your facility, and then we combine it with some nice sightseeing and some nice couple of days spent in Rio de Janeiro, which is definitely a major attraction for everybody. I think that's going to be something really unique for the class that will join us. What's your experience? Because you've done lectures and you've done courses outside of your training center, like we've done also in Romania, and you've received a lot of classes in your hometown, in your training center. What should the dentist that will come with us in Brazil in later this year should expect from this experience? Apart from a course that is being done in Romania, let's say.
I would say that I'm very excited about this project in partnership with you. We prepare our facilities for IDR. Our IDR training center was completely equipped with all the technology that you can imagine. Talk about the digital, and also we have an aquarium in front of the auditorium that I can perform surgery, live surgery for the participants. They usually love this part of the course. So we prepare a 4-day program. This is a special program only for you guys. We have 32 seats, very comfortable seats. So this is the main capacity of our training center, and everybody is invited to join us in this journey to modern implantology. If any of you decides to come to us, it will be a great pleasure to welcome you in my town. And after that, you will be able to go around to visit some places, because in Brazil there are so many places to visit, so many sightseeings in Rio de Janeiro and surround and the northeast part of the country. So if any of you decides to come to us, it will be a great pleasure to welcome you in Brazil, and especially in my town, in Caxias do Sul, in the southeast part of Brazil.
Fantastic. So it looks like the training center you put up there is like tailor-made, as you said.
Absolutely.
Tailor-made. They will have the best experience when we're talking about understanding the idea technique, putting it in practice, working on it, and of course the networking part, which is also very important. We're expecting to have an international class, so it's very nice. The networking also is very important because you always change ideas, you always learn new things. It's not only about the lecture part, but from my point of view, as you say, the journey, the networking part is also very important. And nevertheless, as you said, Brazil is amazing, and discovering that together, I think it's going to be an amazing experience. So I'm looking forward to be there end of the year. I know the weather will be very nice also. So I think we have all the ingredients to have a fantastic 8 days program in Brazil that will for sure take dentists who will attend the program to the next level.
Yes, in this travel, this is not for Romanian colleagues. This is international course, and we prepare a special program 4-day course with theoretical classes, 1-day hands-on, and live surgeries. That's the full package. If you want to go, please don't miss the opportunity to be with us, because you are going to take advantages on the courses and to have fun all together in the same package.
Perfect. So thank you very much for taking time. It was a pleasure talking to you. I'm honored I'm honored to have you along with us in the 32 Academy family. And yeah, I look forward to see us later this year in Brazil. Thank you very much. Stay tuned. Thank you.
Thank you. Thank you for the invitation. Thank you for you, Sorin, and for Arip. All your team, you did a very good job. I'm very happy to be here, and I really hope to see you there in Brazil this November.